Hello there, dear friends, and welcome. It's so good to have you with us today. Have you ever found yourself on a sweltering summer day, perhaps after a bit of gardening or a warm walk, reaching for a tall glass of iced tea or lemonade? And as you finish your drink, there they are, those tempting, clinking ice cubes at the bottom of the glass. It's almost an unconscious reflex for many, isn't it? To pop one in your mouth and enjoy that satisfying crunch, that burst of coolness. It seems harmless enough, a simple pleasure to beat the heat. But what if I told you that this seemingly innocent habit, especially as we gather more candles on our birthday cakes, could be setting the stage for a rather painful and unwelcome dental emergency? I recently heard about a gentleman. Let's call him Mr. Harrison. He's a vibrant man in his late 60s, enjoys his daily walks and loves a cold drink afterwards. One afternoon, just like any other, he was enjoying the leftover ice from his iced water. He bit down, heard a sharp crack, much louder than the usual ice crunch, and felt a searing pain shoot through his jaw. His enjoyable afternoon instantly turned into an anxious rush to the emergency dentist. A significant piece of his molar had broken off. Mr. Harrison was shocked. He'd been chewing ice for years without a problem. Why now? His story, unfortunately, isn't unique, and it brings us to a really important topic, especially for those of us who are 60, 70 or beyond. Why chewing ice cubes after 60 can lead to shattered teeth, and what we can do to protect our precious smiles. So, if you've ever crunched on an ice cube, or know someone who does, I invite you to stay with me. We're going to explore this cool habit that might just be a hidden danger zone for our teeth. We'll uncover why our teeth become more vulnerable as we age, and, most importantly, how we can keep them strong and healthy for all the joyful years ahead. First, let's talk about what happens to our teeth as we journey through life. You see, our teeth are incredibly resilient, designed to withstand decades of chewing, biting, and grinding. They are true marvels of natural engineering, but like any well-used tool or any part of our amazing bodies, they undergo changes over time. After 60, several factors come into play that make our teeth, shall we say, a little less forgiving than they were in our youth. We could call this the fragility code of aging teeth. One of the primary changes is natural wear and tear. Think about it. For 60, 70, or even more years, your teeth have been working hard for you every single day, at every single meal. This constant use gradually wears down the enamel, which is the hard, protective outer layer of your teeth. Imagine the enamel like the tough outer shell of a nut. Over time, with repeated pressure, that shell can become thinner and more susceptible to cracking. Then there's the issue of gum recession. As we age, our gums can naturally recede or pull away from the teeth. This isn't always due to gum disease, though that can certainly accelerate it. Sometimes it's just a slow, gradual process. When gums recede, they expose more of the tooth root. Now, the root of a tooth isn't covered by that super hard enamel. It's covered by a softer material called cementum. This part of the tooth is much more sensitive and not designed to withstand the same kind of impact as the crown, the visible part of your tooth. So, exposed roots mean more vulnerability. And speaking of enamel, it not only wears down, but can also become thinner and more brittle with age. The mineral density might change, and it can lose some of its youthful resilience. Think of it like an old piece of china. Still beautiful, still functional, but you'd handle it with a bit more care than a sturdy everyday mug, wouldn't you? Our teeth are similar. They've served us well, but they require a gentler approach as the years go by. Furthermore, many older adults might have existing dental work, fillings, crowns, bridges. While these restorations are designed to be strong, the tooth structure around them can still be a point of weakness. An old large filling, for example, might mean that the remaining natural tooth wall is thinner and more prone to fracture under stress. All these factors, the wear and tear, the gum recession exposing softer parts of the tooth, the thinning and more brittle enamel, and the presence of previous dental work, combine to significantly reduce the tooth's ability to withstand strong external stimuli or sudden impacts. Our teeth, in essence, lose some of their shock-absorbing capacity. They become less like a resilient young tree bending in the wind and more like an older, drier branch that might snap under pressure. Understanding this inherent vulnerability is the first crucial step. It's not about being fearful, but about being informed, so we can make choices that support our long-term dental health. It's about respecting the journey our teeth have been on and giving them the care they now deserve. So now that we understand that our teeth might be a bit more delicate after 60, let's look specifically at how an innocent-looking ice cube can turn into a dental disaster. How does this frozen water attack our teeth, making them so vulnerable to damage? There are primarily two ways this happens: through direct physical impact and through sudden temperature shock. Let's first consider the physical impact, what I call the hard damage from ice. Ice, especially when it's frozen solid, is remarkably hard. It's harder than you might think. When you bite down on an ice cube, you're essentially subjecting your teeth to a significant concentrated force. Your jaw muscles are incredibly strong, capable of exerting a lot of pressure. When that force meets the unyielding hardness of an ice cube, something has to give. And if your tooth enamel is already thinned, or if there are tiny invisible stress lines from years of use, or if a tooth has a large filling, that give can unfortunately be your tooth. Imagine you're trying to crack a very hard nut with your teeth. You'd probably hesitate, right? Because you intuitively know there's a risk. Chewing ice is very similar. Each crunch sends a shockwave through the tooth. For a young, healthy tooth with thick enamel, it might withstand this. But for an older, more vulnerable tooth, this repeated pressure can be like a tiny hammer, repeatedly striking the same spot. This can cause several things to happen. It might lead to what dentists call craze lines and tiny hairline cracks in the enamel. Initially, these might not cause any pain or be visible to the naked eye. But over time, and with continued ice chewing or other hard food consumption, these craze lines can deepen and propagate. They can eventually extend through the enamel and into the dentin, the softer layer beneath the enamel. When a crack reaches this far, you might start to experience sensitivity. And in a worst-case scenario, like with our friend Mr. Harrison, the force can be enough to cause an outright fracture. A cusp, one of the pointed parts of your molar, can break off. Or more seriously, the tooth can split vertically. These types of fractures are often painful and can be quite challenging for your dentist to treat, sometimes even leading to the need for tooth extraction. It's a sudden, traumatic event for the tooth, all from something that seemed so harmless. Now let's talk about the second way ice attacks our teeth, temperature stimulation, or what I call the icy inferno effect. This is a bit more subtle than the direct physical force, but no less damaging. Our teeth are accustomed to the relatively stable temperature inside our mouths. When you introduce something extremely cold, like an ice cube, directly onto the tooth surface, it causes a rapid and dramatic drop in temperature for that tooth. What happens when materials get cold? They contract, and when they warm up again, which happens quickly in the mouth, they expand. This rapid cycle of contraction and expansion creates stress within the tooth structure, particularly in the enamel. Think about pouring very hot water into a cold glass or vice versa. You've probably heard that this can cause the glass to crack, right? It's due to thermal stress, different parts of the glass expanding or contracting at different rates. A similar principle applies to your teeth. The enamel and the dentin beneath it have slightly different rates of thermal expansion and contraction. So when you repeatedly expose your teeth to extreme cold from ice, followed by the warmth of your mouth, you're essentially creating these tiny stresses over and over again. These repeated temperature shocks can lead to the formation or worsening of those microscopic cracks in the enamel we talked about earlier. Even if the ice doesn't directly fracture the tooth through brute force, this thermal cycling weakens the enamel over time, making it more susceptible to future damage from chewing or other impacts. Moreover, this sudden cold can be a real shock to the dental pulp, the innermost part of your tooth that contains the nerves and blood vessels. If you have any gum recession exposing the root, or if the enamel is thin, or if you have a deep filling close to the pulp, that cold sensation can travel very quickly to the nerve, causing a sharp, sudden pain. This is your tooth's way of screaming, "That's too cold." Repeatedly subjecting the pulp to this kind of thermal stress can over time lead to inflammation of the pulp, a condition called pulpitis. And pulpitis, if left untreated, can lead to more serious problems, which we'll touch on shortly. So it's a double whammy, really. The hardness of the ice delivers a physical blow, and its coldness delivers a thermal shock. Both of these can compromise the integrity of our teeth, especially those that have already seen a bit of life. It's a combination that our older, wiser teeth would really rather we avoided. Now, what happens when a tooth does succumb to this pressure, or temperature shock and a crack or fracture occurs? What are the emergency alarms our body sounds? Understanding these symptoms is crucial because early recognition can lead to quicker treatment and potentially save the tooth. The most immediate and obvious symptom, as Mr. Harrison experienced, is often pain. This pain can vary. It might be a sharp, sudden pain when you bite down, especially when you release the bite. This is characteristic of what dentists call cracked tooth syndrome. The pain occurs because when you bite, the crack opens slightly, and when you release, it closes, irritating the dental pulp. You might also experience increased sensitivity. Suddenly, hot or cold foods and drinks, or even sweet or acidic things, cause a twinge or a sharp stab of pain in a specific tooth. This sensitivity often arises because the crack has exposed the dentin, which has microscopic tubules that lead directly to the nerve. Or, as we discussed, the cold itself has irritated the pulp. Chewing can become difficult or uncomfortable. You might find yourself unconsciously avoiding chewing on one side of your mouth because it's just not comfortable anymore. This can affect your ability to enjoy your food and can even lead to jaw muscle imbalances if it goes on for too long. Visually, you might not see anything at first, especially if it's a hairline crack. However, if a piece of the tooth breaks off, you'll likely feel the sharp edge with your tongue, or you might even see the fractured piece. If a crack is significant or if it's left untreated, more serious complications can arise. The crack can allow bacteria to seep into the inner parts of the tooth, leading to inflammation and infection of the dental pulp. This is called pulpitis. Initially, it might be reversible with prompt treatment, but if it progresses, the pulp can die, and the infection can spread beyond the tip of the tooth's root into the surrounding bone. This is known as periapical periodontitis, or a dental abscess. Symptoms of this can include persistent throbbing pain, swelling in the gum or even the face, a bad taste in your mouth, and sometimes fever. These are serious infections that require urgent dental attention, often a root canal treatment or in some cases extraction of the tooth. So you can see, a seemingly small habit like chewing ice can unfortunately cascade into a series of quite significant dental problems, causing pain, distress, and potentially costly and complex treatments. It's a clear warning sign that our teeth are trying to send us, and it's one we should definitely heed. Okay, so we've talked a lot about the risks and the potential problems, and I know some of this might sound a bit alarming, but the good news is, there's so much we can do to protect our teeth and keep them healthy and strong for many years to come. Knowledge is power, and now that we understand the vulnerabilities, we can take proactive steps. So let's talk about Operation Tooth Protection. This involves both good daily habits and the support of dental professionals. First, let's focus on daily dental care. These are the good habits that truly nurture healthy teeth. The most obvious one, given our discussion, is to consciously avoid chewing on ice cubes or other very hard objects. If you love the coolness of ice, let it melt in your mouth or enjoy chilled drinks without chewing the solids. Find other ways to get that cooling sensation, perhaps a cold piece of fruit like melon or simply sipping icy water. Making this one change can dramatically reduce the risk of tooth fracture. Next, be mindful of acidic foods and drinks. Things like citrus fruits, sodas, even diet ones, and vinegar-based dressings can erode enamel over time, making your teeth weaker and more susceptible to damage. I'm not saying you have to avoid them completely, but moderation is key. And when you do consume them, try to rinse your mouth with plain water afterwards to help neutralize the acids. Wait about 30 minutes before brushing, as brushing immediately after acid exposure can sometimes cause more wear on softened enamel. When it comes to brushing, the tools and technique matter. Choose a toothbrush with soft bristles. Medium or hard bristles can be too abrasive, especially if your gums have receded or your enamel is thinner. A soft brush is perfectly effective at cleaning your teeth without causing unnecessary wear and tear, and how you brush is just as important. Use gentle circular motions, ensuring you clean all surfaces of each tooth, the outer, inner, and chewing surfaces. Aim for at least 2 minutes twice a day. Think of it as a gentle massage for your teeth and gums, not a vigorous scrubbing session. And please, don't forget to clean between your teeth. Your toothbrush bristles can't effectively reach into those tight spaces. This is where dental floss, interdental brushes or water flossers come in. Cleaning between your teeth daily removes food particles and plaque that can lead to cavities and gum disease, both of which can weaken your teeth over time. If you find flossing difficult, ask your dentist or hygienist for advice. There are many tools available now that can make it easier. Staying hydrated by drinking plenty of water is also surprisingly beneficial for your teeth. Water helps rinse away food particles and sugars, and it promotes saliva production. Saliva is your mouth's natural defense mechanism. It neutralizes acids, contains minerals to help remineralize enamel, and has antibacterial properties. Consider using a fluoride toothpaste, and perhaps even a fluoride mouthwash if your dentist recommends it. Fluoride is a mineral that helps strengthen enamel and can even repair very early stages of tooth decay. These daily habits might seem small, but consistently practiced, they add up to make a huge difference in the long-term health and resilience of your teeth. They are your first line of defense. Now, while daily home care is absolutely fundamental, it's also incredibly important to have professional support on your dental health journey. That's where regular visits to your dentist come in. Think of your dentist and dental hygienist as your partners in maintaining a healthy smile. This is particularly crucial after the age of 60. So, the second part of our Operation Tooth Protection is professional care, and specifically, making regular dental checkups a non-negotiable part of your health routine. How often should you go? For most adults, every 6 months is a good guideline, but your dentist will advise you based on your individual oral health status. Some people might need to go more frequently, others less. What happens during these visits? Well, a lot more than just a quick look. Your dentist will perform a thorough examination of your teeth, gums, and entire mouth. They are looking for early signs of potential problems, things you might not even be aware of. This includes looking for tiny cracks or fissures in teeth, early signs of decay, cavities, wear patterns, signs of gum disease, and even screening for oral cancer. Early detection is absolutely key. A small issue identified and treated early is far simpler, less invasive, and less costly to manage than a problem that's been allowed to progress. It's that old saying, a stitch in time saves 9, and it couldn't be truer for dental health. Professional cleaning, often done by a dental hygienist, is also a vital part of these visits. Even with the best brushing and flossing at home, plaque can harden into tartar, or calculus, which can only be removed with professional instruments. This cleaning helps prevent gum disease and keeps your teeth feeling smooth and fresh. Your dentist can also offer personalized advice based on your specific needs. They might recommend specific products, demonstrate techniques, or discuss options for addressing any existing issues, like replacing old fillings that might be at risk of failing or strengthening a weakened tooth with a crown. They can also take dental x-rays when necessary, which can reveal problems hidden from view, like decay between teeth, issues under existing fillings, or problems with the bone supporting your teeth. Please don't wait until you're in pain to see your dentist. Pain is usually a sign that a problem has already become quite advanced. Regular preventative checkups are designed to catch issues before they cause pain, before they become emergencies like Mr. Harrison's cracked tooth. I understand that some people might have anxieties about visiting the dentist, perhaps due to past experiences or financial concerns. If you have anxieties, please talk to your dental team about them. Modern dentistry has many ways to make your visit comfortable and stress-free. And if cost is a concern, discuss it openly. Many dental offices offer payment plans or can help you prioritize treatment to fit your budget. Investing in regular preventive care is almost always more cost-effective in the long run than waiting for emergencies to happen. So, embrace your dental team as allies. They are there to help you keep your smile healthy, functional, and beautiful for all your years to come. Well, dear friends, we've covered quite a bit of ground today, haven't we? We started with that seemingly innocent crunch of an ice cube on a hot day, and journeyed through understanding why our teeth, especially after 60, become more vulnerable. We've explored the fragility code of aging teeth, the wear and tear, gum recession, and thinning enamel. We've delved into how ice can attack our teeth through both its hardness and its extreme cold, leading to cracks, fractures, and pain. And we've discussed the serious consequences that can follow if these issues aren't addressed. But most importantly, we've talked about what we can do. We've outlined a plan for Operation Tooth Protection, emphasizing those crucial daily habits, saying no to ice chewing, being mindful of acids, using a soft brush correctly, cleaning between our teeth and staying hydrated. And we've highlighted the indispensable role of our dental professionals in providing regular checkups, cleanings, and early interventions. The key message I hope you take away today is one of empowerment and gentle caution. Chewing ice after 60, or indeed at any age but particularly as we get older, is a habit that carries real risks of painful fractures, sensitivity, and the potential for more serious dental complications. It's one of those ice-cold traps that, with a little awareness, we can easily sidestep. Our teeth have served us faithfully for many decades. They've helped us nourish our bodies, express our joy through smiles, and communicate with loved ones. They deserve our care and respect, especially now. It's never too late to adopt healthier habits or to re-engage with regular dental care. Every small positive change you make can contribute significantly to preserving your dental health and, by extension, your overall well-being. So, I encourage you, I truly do, to reflect on what we've discussed. Perhaps you're an ice chewer yourself, or you know someone who is. Maybe this conversation has been a gentle nudge to schedule that dental checkup you've been putting off, or to pick up some dental floss on your next trip to the pharmacy. What's one small step you can commit to today for the sake of your smile? I'd love to hear your thoughts. If you found this information helpful, please consider sharing it with friends or family who might benefit. And of course, if you haven't already, do think about liking this video and subscribing for more content aimed at living well and healthily. Let's say goodbye to the ice-cold trap and embrace habits that lead to strong, healthy, happy teeth. Because a healthy smile truly is a gift at any age. Thank you so much for joining me today. Take wonderful care of yourselves and of those precious smiles. Until next time.